We had the privilege at the AAN of presenting the Cleveland Clinic experience with Tele-Neurology, and specifically subspecialty outpatient Tele-Neurology. So in the fields of medicine, telemedicine has been utilized more frequently for a lot of chronic conditions, and there's been a lot of promising data that patients enjoy it, they get a lot of satisfaction out of it, that it improves access to care, and also has the potential to reduce costs. But within the field of Tele-Neurology, there's actually been kind of a slower uptake of the utilization. The initial kind of use of Tele-Neurology was in stroke care. And so we think of like the telestroke, where you improved access to neurology at a large variety of hospitals on an acute basis, inpatient basis to provide stroke care. But there's been even less utilization in sort of the more chronic outpatient neurology setting. And so we saw this as a gap at Cleveland Clinic, and so about 4 years ago we started using outpatient Tele-Neurology. And so the study that we presented here kind of just showed that implementation of Tele-Neurology across subspecialty domains. Again, because what is out there in the literature right now is sort of individual utilizations of, within one disease state. And it was in a smaller scale and also kind of different types of platforms. So within the field of telemedicine in general, the initial kind of stage was more inconvenient platforms where patients still had to travel to a physician's office, have someone there with them to connect them to the other kind of subspecialty provider, or it was just an audio-based or was asynchronous. The platform that we utilize at Cleveland Clinic is a video audio conferencing, and it's used on a personal device. So patients just have to have a smartphone or a laptop type thing or computer, and they can connect wherever they want to. So it's definitely a more convenient and accessible option. You don't have to have any kind of truly specialized technology, and you don't have to have kind of an intermediary. So that was sort of the big advantage of sort of the platform that we utilize. And then the other change was obviously the vast use within the subspecialties. And so we presented with sort of that implementation. In the first year, we only had about 30 visits. And then the most recent year, there was over 4,000 visits. And so we presented over 5,000 Tele-Neurology visits across the subspecialties. That represented over 3,000 individual patients. And what we looked at was sort of where those patients were located. We sort of want to know, are these patients that are local or people coming from a distance, to kind of understand that. And what we saw is we broke the data down into close, so kind of the Cleveland area, like a regional thing, which is surrounding cities, a little bit further regional, which is across the state of Ohio, and then far regional, which is kind of everything outlying Ohio. What we saw was there was actually an equal breakdown of where patients were utilizing it. So literally about a quarter in each of the different categories, sort of indicating that it's, local patients are using it. So even the patients that could, drive 10, 15 minutes are still choosing to utilize Tele-Neurology, and their providers think that's a good idea. But then it's also the people that live a great distance are also utilizing it, but there wasn't kind of a preponderance in one location. So that was sort of an interesting observation. And then the other thing was kind of which subspecialties were utilizing it. Headache definitely had the most visits, which also might reflect that we have a large headache department. Epilepsy was next, but again, it was utilized in all of the specialties. And then within that, we also looked at kind of overall travel saved, and so there was over almost 1.5 million miles saved in travel. So it's definitely, in really, we didn't do kind of an economic breakdown of the cost savings, but obviously for patients, that's, gas, time off work, finding somebody. And so there is kind of the hint that there could be substantial savings for patients and then greater access. And then the other thing we looked at is patient experience with it. And so every patient was given the opportunity to kind of rate their experience and their provider. And overall, there was, phenomenal ratings of like 4.7, 4.8 for both of the use experiences on the 5-point scale. So it was well received by patients. So in general, what we kind of saw with our study was that it was feasible to utilize teleneurology across the subdisciplines, that there was an increasing demand from both providers and patients to offer these teleneurology visits. So I think it was kind of a great first step in just indicating that this is, I think it's going to be something that we utilize in the future. It's figuring out exactly where it's best placed and how we can kind of optimize the use of it. Because it's not going to completely take over our in-person visits. There's going to be times our exam is definitely still important within neurology, but I think this is going to be a great supplement to how we practice and a great option for patients to get access to care in a different way.